All right, so here we're gonna begin to learn how to do soft tissue mobilization to the lower legs here with either hands or a device like this, which is just a simple massage stick, super cheap on like Amazon or something. And then eventually we'll be using something like a foam roller to get a little bit deeper and be a little bit more effective. Okay, so I'm gonna go ahead and demonstrate using this. So we're gonna find, first thing we have to do before we even start going anywhere is do some probing. All right, so you're gonna go ahead and you're gonna start searching some areas. The way I like to break this down is inside, top, and then the side of the leg, the outside. So first you can go ahead and take your fingers and you can begin to probe with deep pressure into the inside. Find all of those sore spots. I have just a few. Once you find those, you take stick and you're gonna begin to provide a deep pressure and start to focus on those sore spots. So here's a little sore spot for me, so I'm providing deep pressure and working it out. It shouldn't look like this. This is no good. This is just rolling over your skin. So we're going for find sensitive area, deep pressure, work that area. Breathe. We're trying to make it less sensitive. This is going to hurt, but it should hurt so good. It shouldn't be so intense that it's killing you. It shouldn't feel sharp, okay? It should just be maybe sore and maybe a little bit achy, okay? Next, I'll probe on the top. You wanna start right up near, not on the bone, but just past that. Sink down. This is your hip flexor. And you wanna see if there's any sore spots along the way. And then you can start up in here. So here, deep pressure, working, deep, beautiful. Then you rinse and repeat. The one to hit the side, sometimes a little tricky. You might have to reposition yourself in the chair a little bit, but same idea. We'll probe, find if there's anything sore. For me, it's more in here, deep pressure, and we can work that out. Now, I showed you everything with the stick. How to use your hand, okay? So a little bit trickier, takes a little bit more elbow grease, but can be done, especially when you're in a pinch and you don't have a stick. So same principles, you probe, then you use something like your fist, your forearm, or your elbow to sink in and slowly work it out. So I had some spots in here. I can go ahead and lean over. I could sink in using this hand to help guide, and I can do my own massage like so. Okay, so the inside of the leg, the elbow, kind of back of the elbow works really nice in regards to leverage. Okay, really easy on the body, not too bad. More effort, but you can get really deep and specific. I use my hands and elbows all the time. Next spot, be hip flexor. So here, you can use forearm typically is what I like to use, and you can sink in with that forearm. Always trying to use another hand as leverage if you can. You can sink in and you can begin to start working those sore spots. You might even find like the forearm might even be more effective than the stick. Use whatever works best. They're just tools. These are all tools to help get you out of pain and help get you better. So just use the best tool for you. Perfect. The goal, again, working out sensitive areas. All right. Last thing here, again, this is one of the harder things to hit. Best done, honestly, with a foam roller. But again, if you're in a pinch, this is how you get it done. You probe, sore spots, hand over hand, and you're gonna sink in. Use that hand, the other hand. This hand is providing pressure. This hand is guiding. Sink in and go ahead and work those sore spots. All right, so pretty straightforward. Probe, target areas, right? Find sore spots. Use something like a stick, like your elbow, like your forearm, or like your hand, with the other hand guiding to provide deep, slow, targeted pressure while breathing through it in order to attack these things. All in all, when performing this, you should be spending just a few minutes with it. It shouldn't be spending like an hour, just something to prime the tissue up and get it ready for stretching, mobility, and exercises.